All right, Dr. Fanale, thanks for talking with me. The first question everyone has is, did Care New England get hacked? Is that what you think happened here?
We've got our security incident that occurred that affected some of our systems. So not exactly sure how it happened, what happened, but obviously we've got everybody working hard we've got some expert computer forensic consultants working with us to try to analyze what's happened and how we get back online.
Can you give me a sense of how much disruption it's caused to the hospital's operations?
Well, the bottom line is, and like I said, I'm not an IT expert. I'm going to tell you what I know in layman's terms is when there's been this incident, what we've done is we tried to shut everything down to try to analyze what it is. The good news is we've been able to continue to take care of our patients, save for a couple of small areas where we couldn't. For instance, some of the backup radiology systems aren't functioning, but all the patient care, surgeries went on as normal. Mostly everything has not affected patient care. Our backup systems are working. You devolve to paper when these things happen. They go away, like I learned. We really hasn't affected, I think, about 99% of the patient care. Our patients should know they're safe. And if we didn't think we were safe, we wouldn't continue to do the procedures and things that we're doing.
We've seen reports in other places of ransomware attacks on different hospital systems where they demand a ransom, these hackers or whoever these bad actors are. Have you received anything like that indicating that's what's going on here?
Again, we're having our experts review all this stuff. It's been a security issue. The IT folks are working on it, outside consultants, legal. So that's the extent of which we can report today, because we don't have all the information yet. So we're working on that even through the night. What we're focused on, Ted, really, what we're focusing on is getting as much backup as quickly as we can and analyze where we are so we can fix all the systems.
Has the FBI or any other law enforcement agency gotten involved yet?
Not to my knowledge, but the forensic experts working with us will contact the authorities at the appropriate time.
And any concern about, patients might hear this and wonder about their patient data, credit cards, or their personal health information. Do you have any sense of whether any of that was compromised?
As at this point, we don't know if any was compromised. That's also part of the analysis, which we'll know by, I think, tomorrow morning. Again, that's obviously a concern of ours as well. But we're fairly confident that we can work through that and have an answer to that tomorrow. Okay. But I right now, we don't know that, and we don't think that's happened. We don't think that's happened.
I should just ask, just for a little bit of a TikTok, like, when did you first learn from, I assume from your staff, we might have a problem here, and when did you realize it was somewhat serious?
We learned of a problem early this morning, and we thought it was serious from the outset, so we jumped all over it. So sometime between 6 and 7 this morning, I was here a little after 6, I noticed there was a problem. We'd already been alerted, and we were all over it immediately. So we thought it was concerning right at the get-go.
And have your IT experts given you any sense of when things will feel back to normal for you and the rest of the CNE staff?
Well, I think importantly for the patients, Ted, I think they're not going to see anything different, except some technical things that we do, we're kind of going to delay for a couple of days. Some of the things we are going to delay for a day or two to make sure we got everything up and running. But generally, the hospitalizations, the ER visits, the surgery, they're all going off safely. Our pharmacy machines work. All that stuff's working. We will not put anybody in jeopardy if this doesn't work. But as far as the staff, which is, you're right, they're the ones that are doing all the extra work because they're not used to doing on paper. We'll know better by the morning, and then we'll be able to sequence and tell them. One of the challenges, we kind of shut everything down, so I'm having trouble communicating with everybody. Hey, I'm looking at you on my telephone, which I've never done that before either.
Yeah, I know. Even with sending your statement, I know you should use a personal email for that today.
Yes.
Anything else I should ask you about, or anything we didn't cover about the situation at the moment?
Yeah, I know this is going to sound, I don't know, collegial, but our neighbors across the street have been helpful again. Tim called me this morning. We've had one thing we needed help with. They helped us. I think the whole community's helping. I've gotten calls from Blue Cross to help us. So again, this is the kind of thing that occurs. I'm sure they're all thankful it's not them. But again, I can shout out for Blue Cross, Lifespan, and others that have just called and have been very, very helpful today. So that's the kind of community in which we work. And, I think it's just been heartwarming, to be honest with you.
All right. Thanks, Dr. Fanale, on a busy day. Thanks for taking the time to talk with me.
Thanks, Ted. Take care.